Hi, I'm Lori Lashney, and today I'm going to be giving you my informative speech on the venipuncture process. But first, I'm going to introduce my audience. This is Trey Shelby, one of my audience members. Alright, this is my other audience member, my little sister, Carmen Alexander. And they're going to be listening to my speech today on the venipuncture process. Okay, the title of my speech today is The Bloody Process with Many, Many Benefits. The purpose of my speech is to inform my audience of the many processes of venipuncture, what the necessity of venipuncture is, and also I'm going to demonstrate a couple types of the venipuncture process that I believe will show my audience not to be so anxious when they go to the doctor. Maybe, they'll learn something during this speech that will help them calm their nerves and really learn that it is a normal, everyday occurrence in the medical field. It's performed by many, many medical professionals, including EMTs, dialysis, people who give kidney dialysis. It is performed by phlebotomists every day. That's their job. Mainly is to do venipuncture in any kind of medical setting, hospitals, clinics, elderly homes. Venipuncture just plays a very big role in today's medical field. It's carried out for two main purposes. These main purposes are to diagnose the patient, to let the patient know what is actually going on with their body and how to treat what is going on with their body. It is also a big tool in monitoring the components of blood. Like if you're a diabetic, we use venipuncture to gain access to your blood. We get your blood and we can tell your glucose levels, whether you need to take that dose of insulin or whether you need to, hold off on that piece of chocolate cake because you may go into a little sugar shock. As I've gone over this and we have evolved in our technology over the years in the medical field, we have gained access to better equipment for venipuncture. We have different types of needles. We have different types of lancets. We have different types of vacutainers to help us obtain, with the less pain for the patient, the best venous specimen we can. We can do this by using the finger stick method, which I'm going to go over with you, which I can run a CBC on, a complete blood count, which is to monitor, like I said, the components of the blood. I can count white cells. I can tell you if you have a viral or bacterial infection by this process. I'm also going to use the same VP process, maybe. Well, it is the same VP process, to show you a lead test. Many people who work around lead or who are exposed to homes who have lead, which has lead painting or lead toys in children sometimes, I'm going to do a capillary filter paper lead test. And then I'm going to do the normal, what everybody knows is venipuncture process, and it's going to be taking a sample from the median cubital vein of one of my audience members. So right now, we're going to do this, and I'm going to do the CBC, which is a finger stick, and I'm going to gain the blood to do a complete blood count. Then I'm going to use that same finger stick where I stuck, and I'm going to show you how to complete a lead test. And then, like I said, I'm going to also demonstrate the VP process of obtaining the specimen from the median cubital vein. All right, if I could have an audience member. All right, yeah, come on, Carmen, you can do it. Just have a seat right there in that chair and let me turn my computer to us. Okay, first and foremost, gloves. Gloves keep us safe. There are a lot of different things out in this world that we don't want. There are many diseases that are communicable by blood. So always have a good pair of gloves, like these, a really good pair of gloves that are tight and that fit. First, I'm going to show you this collection of a CBC. All right, Ms. Alexander. Today, I'm collecting blood. This is just a capillary puncture. Use the middle or the ring finger. Clean it with an alcohol pad. You will then take your lancet, pop off the safety cap, place it against the patient's finger, and pop. You will then squeeze and let it run. And for my patients, I like for my patients to hold their finger over. And I will squeeze, the blood will come out, and I will put the capillary tube to it, and it is sucking up the blood. You will do this several times till you gain enough blood to take to the lab to run the CBC. Of course, this is not enough, but I'm not here all day. You would then take your specimen to the lab and run your CBC, and you would obtain what medical findings, and you would show the physician. All right, I'm going to put pressure on this for just a minute to let it quit bleeding. And then I'm going to put a Band-Aid on the patient. Okay, and now I'm going to show you how to take blood from the arm. This is from the median cubital vein. This is the most commonly form of venipuncture process, and this is my patient, Carmen. She needs her blood taken. She needs a TSH, a lipid, and a CMP. First, we apply the tourniquet. Okay. Will you make a fist, please, Mrs. Alexander? I will then take an alcohol pad, and I will clean the site. I will then open my equipment. This is my BD Vacutainer push button winged needle. It's already got the tubing. I would then get my tube guard so there's no splashback, all for safety measures. And then I would then gain my marble tube because we're doing a CMP, lipid, and a TSH on this patient. We would then take the safety off the needle. All right. If you'll just relax your arm, Miss Alexander. Sometimes to bring the vein up, you can give it a little tap. There it is. A little more alcohol. And we are ready. Now, Miss Alexander, there's going to be a little stick. And then you just push your Vacutainer down, and I am obtaining her blood. Okay, once the process is over, we will take our Vacutainer out of our shield. We will undo the tourniquet with the same hand. We will grab our cotton ball, place it over the needle, and push the button. Our needle is out. This will be placed in our container, our Sharps container. And then I will take my specimen of blood here, as you can see, take it to the lab and run the necessary test to show Miss Alexander exactly what is wrong with her. If she's feeling bad, or if her lipid levels are low, or if we're just going to check her levels of Depakote. Maybe she takes Depakote for seizures, and we may need to make sure she has enough. Now, this concludes my speech, and I hope that this helps you calm your nerves and your anxieties of having your blood taken. It's evolved over technology, but just remember that every day people give blood through this measure, and that every day lives are saved through this measure also. That's why it's such an important part of our everyday medical technology field. Thank you, and you have been a great audience.